It's my pleasure now to invite the President of the Indian ROP Society, Dr. Rajvardhan Azad. Doesn't need an introduction to any of us. He's going to be talking about the ROP burden and what is unique to the possible screening failure that we are having in India and how we could possibly tackle that.
Thank you very much, and nice to be here. I'm thankful to Shankar Nethrale and also our Indian ROP Society for organizing this meeting. So since the time is very short, I will go on to the presentation. We account for, Asia accounts for 50% of the world preterm birth. This is a huge number. And in our country and also in the Asian country, a severe form of ROP, basically is seen in the heavier infants. So this is something to be noted. We are hosting, the South Asia, 32.5% of the total blind people. And if we look into the maturity, we will find almost 23.6% India is having out of the global population. And similarly, if we consider the blindness, we have 15% of the ROP blindness out of the total blindness in the world. Now, what are the challenges? The challenges we have in screening, and that is there is a barrier to the effective screening. And the most important point in ROP is the early detection and treatment, because there is a very thin line between seeing eye and the blind eye. So considering that, this is very important. The other thing is the awareness. Yesterday we had an awareness workshop. We had a lot of these awareness workshops in India and also in abroad. And then the most important part is the lack of trained manpower to tackle this disease. And for this we need super specialty training. Now, what are the challenges? And the challenges, this is just a study in Indian pediatrics in 2016. We find that there are 708 eyes are there, and out of this 115 eyes were in stage 5 ROP, and both eye was 32.48. This means there's a huge, number of the babies who are going into stage 5 ROP, and most of these babies visited our hospital 7 months after the birth, and the mean delay was 6 months, and the common risk factor was oxygen therapy, and 89.8% of these babies were never screened. Of course, this was in 2016, but now the scenario must have changed because of a lot of these awareness programs and awareness workshops. And there's another study where we have seen that, 86% babies were referred by ophthalmologists and 8.7% babies were referred by pediatricians. And the correct diagnosis could only be done by 4.3%. And the metropolitan city like Delhi shared 30% of these babies who were, referred. And 91.3% babies were irreversibly blind. So these are very startling figures. And then the main crux of the problem is the lack of the trained manpower. And this is something where we have to, take the challenge. And therefore, this is just a computation of the data. And as you can see here, the burden on the whole country or to a family is almost 28.8 lakhs, because the child will live for 60 years and the average cost of treatment is only 15,000 rupees. So for 15,000 rupees, you can, save the amount of 28.8 lakhs rupees for if you do the treatment just for 15,000. This is the national committee. If you have a national committee, that goes a long way in the prevention and detection and the management of retinopathy of prematurity. These are the countries where it is already there. Taiwan, I think there is a national committee. Waichi, who is sitting here, and many other countries they already have, and the other countries they are in the in the process. This study we did just to counter the lack of trained manpower, and we found that given adequate training, general ophthalmologists, non-ophthalmologists are independently reliable in detecting posterior pole changes in retinopathy of premature baby. This means we can, mobilize the general ophthalmologist and also the nurses and paramedical staff to do the screening. And telemedicine is another very important mode of detection and screening of these babies. And several models of these telemedicines are available. One model is, what is being followed in Karnataka by Anand Vinekar. And different models are these. They are live outreach, which is real time. There may be, you can capture the image and send it to the reading center. And you can cover 4 or 5 centers. But this is, according to your own situation and according to your availability and your available manpower and other factors. And AI is something, which is coming in a big way, and it will definitely reduce the load of manpower in early detection and screening of the retinopathy of premature babies. And this society we have formed in 2016, and we meet every year. And of course, this is the 7th meeting. I think it should be 8th meeting of which is in Chennai now. And we are meeting, and also we are doing some research and publication from time to time in different journals of the country and the world. So this is a very important, area, and not many people, want to come here because this needs a lot of devotion and a lot of commitment, and it can't be done in a very cursory way. So thank you very much for giving this me opportunity.